Hi, my name is Dr. John Repole, and I want to thank you for tuning in. I want to talk to you today about our wellness philosophy here at Jacksonville Health and Wellness Center. There's two ways to treat a patient. The first way is really the conventional model, which patient walks in with a list of symptoms. The doctor looks at those symptoms and tries to find an algorithm to kind of meet what's called a diagnosis. Once he has that diagnosis, then he simply looks for the antidote. That antidote is usually found through some sort of pharmaceutical drug or, in some cases, through surgical intervention. The other way of treating a patient is to look at them in a holistic way, and understanding that the body works as a symphony of reactions. In other words, we want to treat the person with the disease rather than treat the disease itself. We want to treat the causative agents rather than treating and suppressing just the symptoms, because the symptoms, of course, are there to tell us that something is wrong. It's like an alarm system that's going off. You can have 10 people with the diagnosis of depression. However, they all shouldn't get the same pharmaceutical drug. Those 10 people with depression may have 10 different etiologies or causes for that depression. In other words, we don't want to use a cookie-cutter approach for someone's ill health. And of course, we don't want to just treat that symptom of depression. We want to find out the mechanisms that cause that quote-unquote disease-like process. So we use what's called a functional medicine approach to treatment. So we're looking at the complex web that we call the human body. We're looking at all the physiology that occurs that creates and manifests the disease state. So we're looking at hormonal dysfunctions. We're looking at neurotransmitter dysfunctions like serotonin and dopamine. We're looking at the gastrointestinal tract. Why? Because we literally are what we eat. If we can't absorb the foods properly, then we can't build the right body. And also our gastrointestinal tract houses about 70–80% of our immune system. We also look at something called oxidative stress, which is simply the amount of free radicals in relationship to the amount of antioxidants, which are found in fruit and vegetables. We're looking at inflammatory markers, and so on. And so we do that through in-office testing. We do that through examination, through consultation, through looking at the person through a different lens, and we take all of that information, and then where we really shine is to get all that information and then present it to the patient in a way that's palatable, meaning that a way that's easy to understand, so we can develop a partnership in the treatment plan. So if you understand what's actually physically happening to your body, it's a lot easier for you to make the appropriate decisions in order to help take you from point A, which is ill health, to point B, which is optimal health. So we present disease as either some sort of excess or toxicity, or some sort of deficiency. And by looking at that model, what is an excess? What is toxic to your body? Is it a food allergy? Is it a pharmaceutical drug? Is it the food that you're eating? And then what are you deficient in? Is there some micronutrient deficiencies or vitamin deficiencies that your body might be having? And if we look at disease through that model, or ill health through that model, then the treatment becomes rather simple. What do we need to do? What do we need to remove from your body? And then what do we need to give you back to hopefully help nurture your body back into health? And nurturing could be anything from the food we eat, to exercise, to lifestyle modifications, and so forth. So we take all that information and then write up an individualized treatment. And the treatment can consist of nutrition counseling, functional medicine evaluations and consultations. We also have mental health counseling here. We also have yoga instructors here. We have chiropractic and body work such as massage. We take into account the stress response to ill health and looking at different ways that we can manage stress through either body work, through mind-body techniques, through breath work, and so forth. So I want to invite you, if this is something that interests you, to come in for an evaluation, and we'd love to talk more about your particular condition and how we here at Jacksonville Health and Wellness can help you. We look forward to serving you, and if you have any questions, please give us a call. Thanks so much for listening.